Hello everyone, I'm Miss Rafa, and today we're going to have a new lesson. Famous doctors. Let's get started. Vocabulary. Doctor, doctor. Philosopher, philosopher. Scientist, scientist. Scholar, scholar. Director, director. Blood, blood. Anatomy, anatomy. In spoken English it is anatomy. حرف الت يلفظ د مخففة. No, no. Knowledge, knowledge. Accurately, accurately. Observation, observation. In British English it is manual. In American English it is manual. In British English it is volume. In American English it is volume. Vocabulary of medicine. Before you read, match the words with the definitions. Injury, injury. Hurt, such as a cut to the body. Allergy, allergy. When you have contact with something that makes you ill, such as an animal or flowers. Surgery, surgery. An operation when doctors cut your body. Treatment, treatment. Medicine or medical care to cure you. Symptoms, symptoms. Signs of illness such as a temperature. Hygiene, hygiene. The rules for keeping you and your surroundings clean. Skills. Focus on famous doctors, the makers of modern medicine. Doctors know all about bodies and illnesses, but where did their knowledge come from? You may be surprised to learn that the study of medicine started over 2,000 years ago. Ibn Sina, Muslim doctor, philosopher, and scientist, born 980 CE. Ibn Sina is called the father of modern medicine. He wrote Qanun of Medicine, one of his most famous books, in 14 volumes. He wrote about the human body, surgery, and the treatments. As a young man, Ibn Sina studied medicine and treated the sick. He described the symptoms of illnesses accurately. The teaching of medicine was based on his work till the 16th century. Even doctors today study his works. Al-Razi, doctor, philosopher, and scholar, born 865 CE. Al-Razi wrote over 50 books and articles. He traveled to many lands. He was the director of 2 hospitals and was very kind to patients. He based his studies on accurate observation of illnesses and was the first doctor to describe allergies. He even wrote a medical manual for the ordinary person. Galen, ancient Greek doctor, born 131 CE. Galen studied medicine at a famous medical school in Egypt. He worked as a surgeon. He learned about injuries and did eye operations. He studied how blood moves around the body. He wrote many books, including a 17-volume book on medicine and anatomy. Doctors continued studying Galen until the 16th century. Hippocrates, ancient Greek doctor, born 460 BCE. Hippocrates is known as the father of medicine. He based his work on observation, the description of symptoms, the study of the human body, and talking to patients. He believed in the importance of rest, a good diet, fresh air, and hygiene. He was the first doctor to say that thoughts and feelings came from the brain. Medical students today, after Hippocrates, promise to treat the sick, keep patients' secrets, and teach medicine to the next generation. Reading. Read the article and copy and make notes in this table. Date of birth 460 BCE. انتبهوا لطريقة قراءة الأرقام. 400 460 60 460 131 CE 865 CE 980 CE. One achievement. المطلوب ذكر إنجاز واحد لكل واحد فيهم. Hippocrates said that thoughts and feelings came from the brain. Galen did eye operations. Ar-Razi, first doctor to describe allergies. Ibn Sina described the symptoms of illnesses accurately. السؤال هذا مو مهم بس حبيت أذكره مشان نتعلم قراءة التواريخ. Vocabulary of medical discoveries. Work in pairs to write the definitions of the discoveries in exercise 3. Then, check your answers with the class.
Blood groups. Blood groups.
The 4 types of human blood.
X-rays. X-rays.
A photograph of the inside of the human body.
Aspirin. Aspirin.
A common painkiller.
Vitamin. Vitamin.
A substance you find in food which is essential for health.
Vaccination. Vaccination.
An injection that protects against disease.
Anesthetic. Anesthetic.
It allows a patient to feel no pain during operations.
Antiseptic. Antiseptic.
Liquids we use to clean injuries and prevent infection.
Antibiotics. Antibiotics.
Pills and creams which prevent the growth of bacteria.
DNA. DNA.
The code we carry in our cells. Listening and speaking. Discovery. Blood groups. Makes giving blood to patients safe. Antiseptic kills bacteria. Without it, simple operations would kill people.
Vaccination.
Stops people getting dangerous diseases. Anesthetic. No one feels pain during surgery. Did you know? Arazi was one of the greatest thinkers of the Islamic world and had enormous influence on European science and medicine. Writing. Write a paragraph about a medical discovery. Give your reasons why you think it is important. The discovery of bacteria. The discovery of bacteria by Pasteur is very important. Most illnesses are caused by bacteria. So without this discovery, thousands of people and animals would die. His work led to creating vaccinations. So now, people can maintain health and prevent the spread of diseases by vaccinations and keeping it clean. In my opinion, this discovery has helped saving people's lives. Activity book. Vocabulary. Patient. Patient. Surgeon. Surgeon. Nurse. Nurse. Operation. Operation. Surgical operation. Surgical operation. Tools. Tools. Surgical tools. Surgical tools. Operating room. Operating room. Or you can say operating theater. Operating theater. Heart rate. Heart rate. Blood pressure. Blood pressure. Breathing. Breathing. Ward. Ward. Painkillers. Painkillers. pain ألم. killer قاتل. قاتل الألم يعني مسكن ألم. bandage. bandage. recovering. recovering. assist. assist. Assist is similar to the word help. Reading. Skills development. Brian is a surgical nurse. He did this specialized course after he qualified as a nurse. First, he had to get some experience working in a surgical department, such as in general or day surgery. But what does a surgical nurse do? Basically, we assist the surgeons. A very important part of the job is getting the patient ready for the operation. We explain to the patient what's going to happen during the surgery and also check that they are healthy enough to have the operation. We also help to prepare the operation room, making sure that it is clean and that all the things the surgeon needs for the operation are there. During the surgery, we help the surgeon by passing him or her the surgical tools needed for the operation. We also keep an eye on the patient to make sure that they are in a stable condition, keeping a constant check on the patient's heart rate, blood pressure, and breathing. When the surgery is over, we count the surgical tools so that none go missing during the operation. Our role doesn't end after the operation. We have to change the patient's bandages and make sure that we give the right painkillers and care in the ward while they are recovering. So really, we're there at the beginning and at the end of their hospital treatment. Read the article. Write Brian's different duties in the correct place in the table. Before the operation. Explain what's going to happen during the surgery. Check that the patient is healthy enough to have the operation. During the operation. Pass surgical tools. Check that the patient is stable. After the operation. Count the surgical tools. Change the patient's bandages. Give painkillers. Write the names of these people from the text. Patient, surgeon, nurse. The person who carries out an operation. Surgeon. The person who helps a doctor in the hospital. Nurse. The person who has an operation in hospital. Patient. Writing. I want to be fitter and healthier. What should I do? Use these notes. Food, exercise, sleep. Food. Avoid sweets and too much sugar. Don't eat too late at night. Eat healthy snacks like fruit or nuts. Exercise. Do regular exercise at least 30 minutes 3 times a week. Do exercise that makes your heart rate faster, as well as stretching exercises like yoga. Warm up before exercise. Relax after exercise. Sleep. Get enough sleep at night. Help box. Don't forget to use first of all, also, in addition, you should, it's a good idea too. Another thing you could do is, what about, why don't you try? Read this problem and give advice. I want to be fitter and healthier. What should I do? To be fitter and healthier. In order to be fitter and healthier, you should take care of food, exercise, and sleep. First of all, you should eat healthy food and avoid too much sweets. Also, you should do regular exercise 3 times a week. For example, you can walk for 30 minutes every morning. Finally, you should get enough sleep at night and you shouldn't go to bed late. In short, if you do as I advise you, you will be fitter and healthier. That's everything for today. Thank you very much. See you next time.